Chris, on the Central Coast, on the CW at 10, Central Coast communities hardest hit by COVID-19 will soon get the help to keep their families safe. Many are essential workers forced to put food on the table during this pandemic. And today, Monterey County supervisors approved a pilot project made up of community-based organizations that will send out a team of healthcare workers to prevent the virus from spreading in these underserved communities. Our KION's Jocelyn Ortega joins us live in Soledad tonight with more on this nearly $5 million project set to start at the beginning of the year. Jocelyn?
County officials say cities like Seaside, Castroville, East Salinas, and even here in Soledad are among those most impacted. Now, this program has money set aside to give education and resources to those people in need. Monterey County officials say 45 community healthcare workers are currently being trained to assist people in underserved communities. They will provide people with education, testing, and financial assistance if they become infected. The workers will be paid under a new pilot project approved Monday by the Monterey County Board of Supervisors. Through county cannabis tax revenue and reserve county funding, nearly $5 million will pay for the project that aims to help with resources like rental assistance, food, medical care, and even temporary housing for individuals in need of a place to safely isolate during the pandemic.
Families were getting behind on rent. They couldn't pay their water bills or their light bills. The food bank, certainly, we have long lines at every food distribution. We know that there's not enough resources. And certainly on some issues like priority vaccination for farm workers and more testing.
The project pulls in community-based organizations like COPA. Maria Elena Manzo, a community leader with COPA, says that as part of this project, 3 churches around these communities would be used to create more COVID-19 test sites.
The St. John the Baptist in King City, Our Lady of Solitude in Soledad, and also St. Mary of Nativity in Salinas.
Manzo says this program also targets people who have limited access to health care, as well as people who are too afraid to seek resources because of their legal status.
There's fear and there's lack of knowledge. The effort that were happening were based on the idea that people have a primary doctor. That's not the case for most immigrants.
Manzo says the goal is to have 100 trained community health care workers to help those groups navigate the system. Monterey County Supervisor Alejo says funding for this program is not coming from federal CARES Act money, which he says has already been used, but comes from a rainy day fund and almost $3 million in cannabis funding.
But we're trying to show our community that this is all local money and we're putting it to good use because this is about saving lives. We don't want that money sitting in an account when we could be using it to really curb this pandemic in our county.
This program